Role that occupational therapy has played for many of our patients over the years is really threefold. Sometimes there are significant motor problems with hand performance. They may develop dystonia, they may develop contractures, certainly in the later stages, which greatly impair comfort as well as their ability to assist in any aspects of care. So often those physical interventions by OT are extremely helpful. Many times it's just adaptive equipment. Can you work with the patient and the family to find better ways to do things, better adaptive equipment that will help them be more independent? I think it's important for the patient to feel that they're not regressing to the point where they have to be fed, they have to be changed. I mean, unfortunately with this illness, that stage does arise, but in the middle stages, there's a lot that can be done with the help of occupational therapy to maintain levels of independence. And I think the third area is, probably less didactic and more the relationship between the occupational therapist and the patient in encouraging them to be more independent, to take advantage of things in the community, help facilitate that with the patient to avoid the social isolation that comes with these progressive disorders.
So at what point do you think the occupational therapist should be introduced to the care team when caring for somebody with HD?
If we have access to occupational therapy through the patient's insurance or resources we have on site, we like the occupational therapist and the physical therapist and the speech and swallowing therapist to meet them on the first visit. I think it's important to get a baseline to find out if there may be subtle things they're noticing that we can educate them about, encourage them about, or reassure them about. Certainly once they begin having trouble with activities of daily living, it's critical to bring occupational therapy into the treatment team.
And I guess to get on maybe just a different level, what can my classmates take home? What can we do as occupational therapists to provide the best care for people with HD? And like you said, you kind of touched on building that relationship, but I know these guys struggle with a lot of depression, a lot of emotional issues when it comes to what's the best way to approach them that you've seen when working with these people and keeping them motivated.
Well, number one, communication with everybody else on the healthcare team. Communication with the family. If you notice something, say something, as they say. And I've had feedback from various, ancillary healthcare professionals, who have been brought in for a specific task. They say, your patient is really depressed. Has he or she spoken to you about that? Or, I noticed, in the home that the family is either unable or unwilling to assist the patient in appropriate ways. They say, she can do it herself. I don't have to open that door for her, even though she's carrying a bunch of stuff and ultimately ends up falling. So I think being able to cite problems before they become major problems, and then communicating with everybody who's responsible for that person. Absolutely. On the other hand, developing that personal relationship with the patient, finding out what they want, what is most important to them. They may not care that they have to be assisted at mealtime, but they may be very distressed that they can't hold their Game Boy and enjoy that the way they used to.
Right. Well, thank you so much.
Good, and thank you for your interest in this set of rare diseases that have huge unmet needs. So anything we can do to help them is going to improve their quality of life, and the family too.
Absolutely. Thank you.
Aaron is a 38-year-old who has Huntington's disease. He has been working as a research assistant, but is preparing to go on disability soon. The onset of HD symptoms manifested 3 years prior, but recently has noticed a decrease in his cognitive abilities, such as initiating, working memory, short-term memory, and sequencing in during his daily routine activities. Aaron and his wife have told the OT that showering has become very difficult lately. Safety concerns were addressed during a previous OT session, where he was taught how to use a shower bench to help prevent any falls due to his decreasing balance. He is able to shower but is now requiring constant verbal cues and reminders due to cognitive impairments. Like other activities of daily living, he needs to be verbally cued to initiate them. After the occupational therapist spoke with the client and his wife, the OT realized his cognitive impairments were largely due to deficits in memory, problem solving, and sequencing. They agreed that the best way to handle these day-to-day struggles with simple activities of daily living would be to use a cognitive retraining approach. Because Huntington's disease affects more than cognition and motor, the occupational therapist wanted to inquire with the client and his wife in regards to his psychosocial well-being. Prior to the onset of symptoms, the client was an avid photographer and loved taking pictures of his family. However, due to the progression of his chorea and dystonia, it has greatly impacted his ability to participate in his favorite hobby, as he now has a difficult time holding the camera steadily while simultaneously pressing the button to capture the pictures. Because most of his photography now comes out blurry, he has dropped his favorite hobby. This concerns his wife because she knows how passionate he was about photography and how much he enjoys going back through all of his old pictures. When Aaron was first diagnosed with Huntington's disease, their doctor informed them of common side effects that they can be expecting as the disease progresses. He explained how depression and mood swings are very common side effects of HD. They have had open conversations about his feelings, and although he is generally a very happy individual, he has expressed his fears and anxieties of leaving his wife behind. The occupational therapist recommends making a photo album to leave behind treasured memories of things they like to do together as a family for his wife to keep. This is very important to Aaron, especially because they do not have any children at the moment, besides the furry four-legged one. One technique used in skilled habit task training is using checklists. General checklists of his morning and evening routines help establish more structure in his day-to-day activities. The OT will teach Allison how to use a checklist for chaining, prompting, and reinforcement each time the sequence is performed. The point of these lists is to help the client sequence and continue throughout activities in a more independent manner, and to help reduce the burden of the caregiver. The goal is also to help train the client to make complex skills more automatic. To initiate activities, the OT suggests setting up daily reminder alerts on Aaron's phone. These will go off at the same time and order every day, coinciding with the lists. The OT reminds his wife that it is important to keep instructions short, simplified, and to the point, must be in sequential order, have an area for them to be able to check off as he progresses through them, and to not proceed to the next step until the previous one is marked as completed. Checklists should be placed in common areas that they encounter on a daily basis, so it's easy for them to see, such as by the restroom mirror. The OT explained to Aaron and his wife that these lists can be made into activity sheets, which can be used in all activities of daily living. After performing an activity analysis of Aaron's showering routine, the therapist and client decided on an optimal sequence of steps and created a checklist as an external aid. Having a step-by-step list enforces proper sequencing of the activity. Having a marker to check off every step that he completes also serves as a memory aid, allowing him to follow through with the entire activity properly. This allows him to have a visual cue of what sequencing step he is currently on. This way, his wife doesn't have to be in the bathroom with him to give him verbal cues for every step. Instead of holding the camera in his hands like he normally did, the OT explained to Aaron that it would be a better option to set it down somewhere safe, or to use a tripod to take pictures for his wife's album. His wife can also help him choose an automatic setting on his camera for better quality. This will decrease the chances of accidentally dropping his camera and ensure that the pictures do not come out blurry. Instead of pressing down the shutter button on the camera, he can use a wireless built-up button. This way, he can take pictures from a distance without having to hold the actual camera. One large button is also easier than the smaller buttons located on the camera, reducing the amount of fine motor skills normally required for his photography.
Smile, Pooch. You gotta smile.
He actually is.
Smile, Poochie. Be a good boy.
Put a hands on Poppy.
Are you ready?
You ready, Dad?
You ready?
Yeah, let's do it.
Alright. 3, 2, 1.